The liver is divided into functional left and right lobes by Cantley's line, a vertical plane extending from the middle of the gallbladder fossa to the IVC. The hepatic veins further divide the liver into 4 sectors, and the liver is further divided into 9 segments. The middle hepatic vein divides segments 8 and 5 of the right lobe from segments 4A and 4B of the left lobe. The right lobe is then split by the right hepatic vein into an anterior sector, segments 8 and 5, and posterior sector, segments 7 and 6. The left lobe is divided into a medial and lateral sector by the left hepatic vein, which runs between segments 2 and segments 3 and 4. The umbilical fissure bisects the medial sector and contains the umbilical fissure vein, a branch of the left hepatic. The caudate lobe, or segment 1, drains directly into the retrohepatic IVC. The principles of liver resection include control of inflow vessels, control of outflow vessels, parenchymal transection, and biliary reconstruction, while ensuring an adequate functional remnant liver. This is an example of a left hepatectomy with resection of segments 2, 3, 4A, and 4B, whereas a right hepatectomy would involve resection of segments 5 through 8. The portal vein provides 75% of hepatic blood inflow and carries poorly oxygenated blood. The main portal vein splits into a right portal vein, which further divides into a right anterior and posterior pedicle, and a left portal vein, which gives off branches to segments 2, 3, and recurrent branches to segment 4. The hepatic artery provides approximately 25% of the hepatic blood flow and is the sole supplier of oxygenated blood to the biliary ducts. Most commonly, the proper hepatic artery splits into right and left hepatic arteries at the hilum and supplies the segments of each respective hemiliver. Hepatic arterial anatomy can be variable, and an aberrant left and right hepatic artery most often arise from the left gastric and superior mesenteric arteries respectively. The right and left livers are drained by the right and left hepatic ducts, which coalesce into a common hepatic duct and then common bile duct. Blood supplied to the ducts is strictly arterial and runs along the lateral borders of the duct at the 3 o'clock and 9 o'clock arteries respectively.